Explain the significance of developmental milestones in pediatric nursing. How would you assess if a child is meeting these milestones, and what actions should be taken if there are concerns regarding developmental delays? Answer: developmental milestones are critical indicators of a child's growth and development, reflecting the expected physical, cognitive, and emotional progression from infancy through adolescence. Key milestones include motor skills, rolling over, sitting up, walking; language skills, babbling, speaking simple words, forming sentences; social skills, making eye contact, playing with others, showing independence. To assess whether a child is meeting these milestones, healthcare professionals utilize standardized tools such as the Denver Developmental Screening Test or the Ages and Stages questionnaires. Parents are often asked to report on their child's abilities during routine checkups. If concerns arise regarding developmental delays, e.g., failure to meet milestones, it is crucial to conduct a comprehensive assessment, reevaluate using additional screening tools and physical examinations, refer for further evaluation. If delays are confirmed, refer the child to specialists such as pediatricians, occupational therapists, or speech therapists. Engage in early intervention. Collaborate with early intervention programs to develop tailored strategies that promote the child's development. The American Academy of Pediatrics recommends regular developmental screenings during child visits to ensure early identification and management of potential delays. Discuss the challenges and best practices associated with weight-based dosing in pediatric medication administration. Answer: pediatric patients often require weight-based dosing due to their varying body compositions and responses to medications. The challenges include calculating dosages accurately. Healthcare providers must convert the child's weight from pounds to kilograms and apply the correct dosage calculations. Variability in absorption and metabolism. Children may absorb and metabolize medications differently than adults, necessitating adjustments in dosing regimens. Best practices for safe medication administration include double-check calculations. Always verify calculations with another qualified healthcare professional. Use standardized dosing instruments. Utilize calibrated syringes or dosing cups to ensure accuracy. Educate parents and caregivers. Provide clear instructions on how to administer medications and explain the importance of adherence to dosing schedules. The Institute for Safe Medication Practices emphasizes the need for standardized protocols and guidelines to minimize medication errors in pediatric settings. What are the key components of patient and parent education regarding immunizations in pediatrics? Answer: patient and parent education regarding immunizations is essential to promote understanding and compliance. Key components include importance of immunizations. Explain how vaccines protect children from serious diseases, e.g., measles, mumps, rubella, and contribute to community immunity. Immunization schedules. Provide a clear timeline for when vaccines are due, emphasizing adherence to the recommended schedule set by the Centers for Disease Control and Prevention (CDC). Benefits and risks. Discuss the benefits of vaccination and address common misconceptions. Clarify potential side effects, which are usually mild, such as redness at the injection site or low-grade fever. Parental concerns. Encourage questions and provide evidence-based information to alleviate fears regarding vaccine safety. Access to vaccines. Inform parents about where and how to obtain vaccines, including community clinics and pediatric offices. Mrs. Thompson is in her third trimester of pregnancy and expresses concern about the pain she may experience during labor. What pain management techniques would you recommend, and what considerations should be made regarding her preferences and medical history? Answer: in managing Mrs. Thompson's concerns about labor pain, it is essential to consider her preferences, medical history, and the various pain management techniques available. Non-pharmacological techniques. Breathing exercises. Teach techniques such as slow-paced breathing or pattern breathing to help manage pain and anxiety. Relaxation techniques. Encourage visualization and mindfulness exercises to promote relaxation during contractions. Hydrotherapy. Discuss the use of warm baths or showers, which can provide comfort during labor. Pharmacological techniques. Epidural anesthesia. This is the most common method of pain relief during labor, providing effective pain control while allowing the mother to remain awake and alert. Nitrous oxide. This inhaled analgesic can help reduce anxiety and pain during contractions. Patient preferences. Engage in a conversation with Mrs. Thompson about her pain management preferences and any previous experiences with pain relief methods. Assess her medical history for any contraindications to specific interventions, e.g., bleeding disorders or allergies. Education and support. Provide information about each pain relief option, including potential side effects and benefits, to help Mrs. Thompson make an informed decision. Describe the key components of a comprehensive newborn assessment and the significance of each in identifying potential health issues. Answer: a comprehensive newborn assessment typically includes the following key components: APGAR scoring, conducted at 1 and 5 minutes after birth. This assessment evaluates the newborn's appearance, skin color, pulse, heart rate, grimace response, reflexes, activity, muscle tone, respiration, breathing effort. A score of 7.10 indicates good health, while a low score may necessitate further intervention. Vital signs. Monitoring temperature, heart rate, and respiratory rate helps identify potential complications such as hypothermia or respiratory distress. Physical examination. Head-to-toe assessment. Check for any congenital anomalies such as cleft palate or spina bifida. Reflexes. Assess primitive reflexes like the Moro reflex and rooting reflex, which indicate neurological function. Jaundice screening. Monitor for signs of jaundice, which may indicate liver issues or hemolytic disease. Parental education. Educating parents about normal newborn characteristics, signs of distress, and appropriate care practices ensures they are equipped to manage their infant's health. The American Academy of Pediatrics emphasizes the importance of thorough newborn assessments in identifying health issues early and ensuring timely interventions. Compare and contrast the management strategies for bronchiolitis and croup in pediatric patients. Answer: bronchiolitis and croup are common pediatric respiratory disorders that require different management strategies. Bronchiolitis etiology, most commonly caused by respiratory syncytial virus RSV. Symptoms: wheezing, coughing, difficulty breathing, and possible cyanosis. Management: supportive care. Ensure adequate hydration and monitor oxygen saturation. Bronchodilators may be administered in severe cases, although efficacy is variable. Hospitalization considered for infants under 6 months with severe symptoms, especially if oxygen levels are low. Croup etiology, often viral, with parainfluenza virus being a common cause. Symptoms: barking cough, stridor, and hoarseness. Management: corticosteroids. Administer dexamethasone to reduce inflammation. Nebulized epinephrine. For severe stridor at rest, nebulized racemic epinephrine can provide immediate relief. Humidified air. Encourage the use of humidified air to alleviate symptoms. Both conditions require careful monitoring and family education on recognizing signs of worsening respiratory distress. What are the key components of postpartum care for a mother after delivery, and how can healthcare providers support her recovery? Answer: postpartum care is crucial for a mother's recovery and involves several key components. Physical assessment. Monitor vital signs, uterine involution, and assess for any signs of complications such as postpartum hemorrhage or infection. Evaluate perineal care and assess the healing of any episiotomies or lacerations. Emotional support. Assess for signs of postpartum depression (PPD) and provide resources for mental health support. Encourage open communication regarding any emotional or physical challenges. Breastfeeding support. Provide education on proper latching techniques and positions to promote effective breastfeeding. Address common issues such as sore nipples or concerns about milk supply. Patient education. Educate the mother about signs of complications, including fever, severe pain, or unusual bleeding. Discuss postpartum contraception options to help her plan for future pregnancies. The World Health Organization, who emphasizes the importance of comprehensive postpartum care to promote maternal health and well-being. Explain the role of patient education in managing a child with a respiratory infection, including strategies to minimize transmission and promote recovery. Answer: patient education is essential in managing respiratory infections in pediatric patients. Key elements include understanding the infection, explain the nature of the respiratory infection, e.g. viral versus bacterial, and the expected course of illness, promoting recovery, encourage adequate fluid intake and rest to support the child's immune system. Discuss the importance of following prescribed medications, including antipyretics, for fever management, minimizing transmission. Educate parents about hand hygiene practices, including regular hand washing and the use of alcohol-based hand sanitizers. Recommend limiting close contact with others, particularly vulnerable populations, e.g. infants, elderly. Recognizing complications, instruct parents to monitor for warning signs such as difficulty breathing, dehydration, or high fever that may require medical attention. Discuss the importance of prenatal screenings during pregnancy and the implications of high-risk pregnancy conditions on maternal and fetal health. Answer: Prenatal screenings are vital for monitoring both maternal and fetal health during pregnancy. Key components include routine screenings, ultrasounds, monitor fetal growth and development, check for structural anomalies and assess amniotic fluid levels, blood tests, screen for conditions such as anemia, infectious diseases, e.g., HIV, syphilis, and genetic disorders, e.g., Down syndrome. High-risk pregnancy conditions. Conditions such as preeclampsia, characterized by high blood pressure and organ dysfunction, and gestational diabetes, elevated blood sugar levels during pregnancy, require careful monitoring and management. The implications include increased risks of preterm labor, low birth weight, and complications during delivery. Management strategies. Implement regular monitoring through increased prenatal visits. Develop individualized care plans that may include medication management, dietary modifications, and potential referrals to specialists. The American College of Obstetricians and Gynecologists (ACOG) outlines the importance of prenatal care in reducing maternal and fetal morbidity and mortality. Describe the guidelines for safe sleep practices for newborns and the rationale behind these recommendations. Answer: safe sleep practices are crucial to reducing the risk of sudden infant death syndrome (SIDS) and ensuring the well-being of newborns. Key guidelines include back to sleep. Infants should always be placed on their backs for every sleep, including naps. This position significantly reduces the risk of SIDS. Firm sleep surface. Use a firm mattress covered with a fitted sheet. Avoid soft bedding, pillows, and toys in the crib, as these compose suffocation hazards. Room sharing. It is recommended that infants sleep in the same room as their caregivers for at least the first 6 months, but not in the same bed. This arrangement allows for closer monitoring while reducing the risk of accidental suffocation. Avoid overeating. Dress infants in appropriate sleep clothing to prevent overeating, which has been linked to an increased risk of SIDS. Regular pediatric checkups. Regular follow-ups ensure that infants are developing appropriately and that parents are educated about safe sleep practices. The National Institute of Child Health and Human Development (NICHD) provides extensive resources and research supporting these safe sleep guidelines to protect newborns from sleep-related risks. What are the primary differences between typical and atypical antipsychotics in the treatment of schizophrenia, and what should the nurse monitor when a patient is taking these medications? Answer: typical antipsychotics, e.g., haloperidol, primarily target positive symptoms of schizophrenia such as hallucinations and delusions by blocking dopamine D receptors. Atypical antipsychotics, e.g., risperidone, treat both positive and negative symptoms, e.g., social withdrawal, and work by affecting both dopamine and serotonin receptors. Monitoring. Typical antipsychotics can cause extrapyramidal side effects such as dystonia, akathisia, and tardive dyskinesia. Regular assessment using the Abnormal Involuntary Movement Scale (AIMS) is essential. Atypical antipsychotics are associated with metabolic syndrome, including weight gain, diabetes, and dyslipidemia. Monitoring blood glucose, lipid profiles, and body weight is critical. Relevant guidelines. NIC guidelines for schizophrenia recommend atypical antipsychotics as first-line treatment due to a more favorable side effect profile. American Psychiatric Association (APAT) advises regular monitoring for both types of medications, focusing on PS for typical and metabolic syndrome for atypical. How does a nurse differentiate between major depressive disorder (MDD) and bipolar disorder in a patient presenting with symptoms of depression? Answer: the differentiation between major depressive disorder (MDD) and bipolar disorder lies in the presence of manic or hypomanic episodes in bipolar disorder. Patients with MDD experience only depressive episodes characterized by prolonged periods of sadness, anhedonia, and fatigue. In contrast, bipolar disorder involves mood swings, with patients experiencing both depressive episodes and manic or hypomanic episodes, elevated mood, increased energy, impulsivity. Key symptoms of mania in bipolar disorder: euphoria or irritability, decreased need for sleep, rapid speech, and racing thoughts. Risky behaviors, e.g., excessive spending, hypersexuality. Clinical considerations. It is crucial to assess the patient's history for any signs of mania or hypomania, which may be subtle and go unreported in depressive states. A family history of bipolar disorder can increase the likelihood of a bipolar diagnosis. Maria, a 35-year-old patient, has been diagnosed with opioid addiction and is currently undergoing detoxification. She has begun to experience irritability, nausea, muscle cramps, and strong cravings. What should the nurse's next course of action be to manage Maria's withdrawal symptoms and ensure her safety? Answer: in Maria's case, the nurse should focus on symptom management and safety during opioid withdrawal, which can be physically and emotionally distressing but is rarely life-threatening. Management includes Pharmacological interventions: administer methadone or buprenorphine for opioid substitution therapy to reduce cravings and withdrawal symptoms. Consider clonidine to alleviate autonomic hyperactivity, sweating, restlessness. Anti-nausea medications such as ondansetron and analgesics like ibuprofen may also be useful supportive care. Maintain hydration and provide a calm environment to minimize irritability. Ensure that psychological support, such as counseling or group therapy, is available for addressing cravings and emotional distress. Relevant guidelines: Substance Abuse and Mental Health Services Administration (SAMHSA) guidelines recommend medication-assisted treatment (MAT) combined with behavioral therapies for opioid use disorders. The Clinical Opiate Withdrawal Scale (COWS) can be used to objectively assess the severity of Maria's withdrawal symptoms. Explain how lithium works as a mood stabilizer in the treatment of bipolar disorder and what key nursing considerations must be followed when a patient is on lithium therapy. Answer: Mechanism of action. Lithium stabilizes mood in patients with bipolar disorder by modulating neurotransmission and intracellular signaling, particularly in the dopaminergic and glutamatergic systems. It also reduces excitability in neural circuits associated with mood swings. Nursing considerations: Therapeutic range. Lithium has a narrow therapeutic range, 0.6–1.2 mcg. Regular blood tests are essential to prevent toxicity. Toxicity signs: Early signs include tremors, nausea, vomiting, diarrhea, and confusion. Severe toxicity can lead to seizures, coma, and renal failure. Hydration and sodium levels. Lithium competes with sodium in the kidneys. Patients must maintain adequate hydration and avoid sodium depletion, as dehydration increases the risk of toxicity. Relevant guidelines: The British Association for Psychopharmacology (BAP) recommends lithium monitoring every 3–6 months and more frequently during dosage changes or if symptoms of toxicity appear. Describe the role of therapeutic communication in managing patients with severe anxiety and how it differs from general communication techniques. Answer: Therapeutic communication involves specific techniques designed to build rapport, trust, and facilitate emotional expression, crucial for patients with severe anxiety who may feel overwhelmed and defensive. Key techniques: Active listening. This involves being fully present, nodding, and summarizing the patient's statements, ensuring they feel heard. Open-ended questions. Encourage patients to explore their feelings rather than answering yes or no. Validation. Acknowledge the patient's fears without judgment. It's understandable that you feel anxious in this situation. Reflection. Mirroring the patient's feelings back to them helps them identify and process emotions. General communication versus therapeutic communication. General communication may include casual or surface-level exchanges, while therapeutic communication is goal-directed, focusing on patient well-being and emotional support. Mr. Thomas, a 45-year-old man diagnosed with schizophrenia, has stopped taking his antipsychotic medication because he believes the medication is harmful. He is exhibiting signs of paranoia and hostility. As his nurse, what immediate actions should you take to ensure his safety and cooperation? Answer: In managing Mr. Thomas, a nurse must employ de-escalation techniques and ensure safety. De-escalation strategies: Remain calm and non-threatening. Speak softly and maintain non-confrontational body language. Acknowledge his feelings. Validate his concerns about the medication while gently offering information on the importance of continuing treatment. Safety considerations: Ensure that other staff members are nearby in case the situation escalates, but avoid creating a threatening environment. If Mr. Thomas remains resistant and poses a risk to himself or others, involve a psychiatrist to discuss options such as short-term hospitalization or involuntary treatment, if applicable under the Mental Health Act. Relevant guidelines: The National Institute for Health and Care Excellence (NICE) guidelines recommend a patient-centered approach to refusal of medication, focusing on open dialogue, risk assessment, and non-coercive interventions where possible. What are the ethical considerations for administering psychotropic medications under involuntary treatment, and how do these regulations vary by jurisdiction? Answer: Administering psychotropic medications under involuntary treatment raises several ethical issues, primarily balancing patient autonomy with duty of care to prevent harm. Key ethical considerations: Autonomy versus beneficence. While patients have the right to refuse treatment, this right may be overridden if they pose a danger to themselves or others. Principle of beneficence. Informed consent. Even in involuntary treatment, patients should be informed about the medications, their benefits and risks. Jurisdictional variations. In many jurisdictions, Under the Mental Health Act in the UK, patients can be treated involuntarily if they lack the capacity to make informed decisions or pose an immediate risk. In the US, the involuntary treatment laws vary by state, with some states requiring a court order for forced medication. What is the role of the nurse in suicide prevention, and what risk assessment tools are commonly used to evaluate suicidal ideation? Answer: the nurse plays a crucial role in identifying risk factors and implementing safety measures for patients with suicidal ideation. Risk assessment tools: Columbia Suicide Severity Rating Scale (CSRS), a widely used tool to assess the severity of suicidal ideation and behavior, helping to quantify the risk level and necessary interventions. SADP, RSONS scale, a mnemonic device assessing factors like sex, age, depression, previous attempts, ethanol abuse, rational thinking loss, social support lacking, organized plan, no spouse, and sickness to gauge suicide risk. Nursing interventions: close monitoring, initiating a suicide watch or constant observation for high-risk patients to ensure immediate intervention if needed. Safety planning: collaborating with the patient to create a safety plan, which includes removing access to means of self-harm and establishing emergency contacts. Counseling and referrals: providing therapeutic communication and referring to mental health professionals for comprehensive evaluation and treatment. Relevant guidelines: the Joint Commission emphasizes suicide prevention as a priority in healthcare settings and mandates assessment and management strategies for at-risk patients. How can the nurse utilize crisis intervention techniques to manage acute psychiatric episodes, and what are the key components of an effective crisis intervention plan? Answer: crisis intervention techniques focus on rapidly de-escalating a crisis to restore emotional equilibrium. Key techniques: establish rapport. Begin with a non-threatening, supportive approach to build trust and create a safe environment for the patient. Assess the situation. Identify triggers, the patient's perception of the crisis, and their emotional state to tailor the intervention effectively. Components of an effective crisis intervention plan. Safety assessment: ensure the immediate safety of the patient and others by assessing for potential harm. Problem-solving strategies: help the patient identify the problem and explore potential solutions, empowering them to regain control over their situation. Resource connection: link the patient to resources, e.g., mental health services, support groups for ongoing support after the crisis. Discuss the significance of community mental health programs in supporting individuals with mental health disorders, and what roles do nurses play in these programs? Answer: community mental health programs provide essential services aimed at integrating individuals with mental health disorders into the community while ensuring they receive necessary treatment and support. Significance: prevention of hospitalization. These programs can reduce the need for inpatient care by providing early intervention and ongoing support, addressing issues before they escalate. Holistic care: they focus on addressing the social, psychological, and environmental factors affecting mental health, promoting recovery-oriented practices that enhance quality of life. Nursing roles: case management. Nurses coordinate care plans, facilitate access to community resources, and monitor the patient's progress to ensure comprehensive treatment. Health education: they educate patients and families about mental health conditions, treatment options, and coping strategies, fostering informed decision-making. Advocacy: nurses advocate for patients' rights and facilitate connections to community resources, ensuring individuals receive the support they need for recovery. A patient presents with symptoms of dehydration after experiencing vomiting and diarrhea for 3 days. Based on the nursing process, what would be the primary nursing diagnosis, and how should the nurse prioritize care? Answer: in this scenario, the primary nursing diagnosis would be fluid volume deficit related to excessive fluid loss due to vomiting and diarrhea. According to the nursing process, the first step is assessment, where the nurse would gather data such as vital signs, fluid intake output, and skin turgor to evaluate the patient's hydration status. The priority is to restore fluid balance, which is crucial in preventing complications like hypovolemic shock or renal failure. In the planning phase, the nurse sets measurable goals, such as that the patient will demonstrate adequate hydration as evidenced by urine output of at least 30 LHR and stable vital signs within 24 hours. This goal reflects a safe and achievable outcome, guided by evidence-based practice. Implementation would involve nursing interventions, including administering IV fluids as ordered, monitoring electrolytes, and educating the patient about signs of dehydration to watch for in the future. Finally, during evaluation, the nurse would assess whether the patient met the expected outcomes, documenting any changes in condition. Adhering to NANDA guidelines throughout this process helps in providing structured, effective patient care and addressing immediate health needs. Under what circumstances can a nurse provide treatment without obtaining explicit informed consent from the patient, and what are the legal ramifications of failing to obtain consent when required? Answer: nurses can provide treatment without explicit informed consent in emergencies when the patient is unable to communicate or give consent and immediate action is necessary to prevent significant harm or death. This is grounded in the legal principle of implied consent, where the law assumes that a reasonable person would consent to life-saving interventions. However, if informed consent is required, such as for elective procedures or treatment not immediately life-threatening, failing to obtain it can result in severe legal consequences, including allegations of assault and battery. It can also lead to malpractice claims if a patient suffers harm as a result of the treatment provided without consent. Informed consent is a fundamental ethical and legal obligation of healthcare providers, ensuring patient autonomy and decision-making capacity. Nurses must ensure that patients understand the nature of their treatment, including risks and benefits, and have the opportunity to ask questions. This process aligns with the Patient Self-Determination Act, emphasizing the necessity of informed consent. Mr. Tanaka, a 70-year-old Japanese-American patient, is being treated for hypertension. He informs the nurse that he prefers to use herbal remedies in addition to prescribed medications. How should the nurse handle this situation considering patient-centered care and cultural competence? Answer: in handling Mr. Tanaka's preference for herbal remedies alongside his hypertension treatment, the nurse should first practice therapeutic communication by actively listening to his concerns and preferences. This demonstrates respect for his cultural background and establishes rapport. The nurse should inquire about the specific herbal remedies Mr. Tanaka intends to use and educate him about any potential interactions with his prescribed medications. It is crucial to review both the efficacy and safety of herbal remedies while providing him with clear, evidence-based information about his hypertension and the importance of medication adherence. Additionally, the nurse can collaborate with the healthcare team, including a pharmacist or dietitian, to address any concerns related to the herbal remedies and their compatibility with conventional treatments. This multidisciplinary approach is essential in promoting holistic, patient-centered care, ensuring that Mr. Tanaka feels heard and involved in his treatment plan. Cultural competence is vital in this scenario, as it enables the nurse to tailor care to Mr. Tanaka's individual health beliefs and practices in alignment with the culturally and linguistically appropriate services clause standards. How does Watson's theory of human caring influence the way nurses approach patient care, and how can this be applied in end-of-life situations? Answer: Watson's theory of human caring emphasizes the significance of forming genuine caring relationships with patients, placing the act of caring at the core of nursing practice. This theory asserts that caring is not just a task, but a holistic approach that encompasses emotional, physical, and spiritual dimensions of care. In end-of-life situations, this theory becomes even more crucial as patients and their families navigate complex emotions surrounding death and dying. Nurses applying Watson's theory in end-of-life care focus on providing compassionate support, promoting comfort, and ensuring the dignity of the patient. They engage in active listening, validating the patient's feelings, and addressing any fears or concerns regarding the dying process. This might include facilitating discussions about advanced directives, preferences for care, and emotional support for both the patient and family members. Additionally, nurses can provide a comforting environment, which may involve ensuring pain management, emotional support, and even spiritual care if desired by the patient. By fostering an environment where patients feel cared for and understood, nurses can help alleviate anxiety and fear, enhancing the overall quality of life even in the final stages. A nurse needs to inform a patient that their condition has worsened and will likely require more invasive treatments. How should the nurse approach this conversation to ensure therapeutic communication? Answer: when preparing to deliver difficult news regarding a patient's deteriorating condition and the necessity for more invasive treatments, the nurse must approach the conversation with sensitivity, empathy, and clarity. First, the nurse should select a private, comfortable setting free from interruptions, ensuring the patient feels secure and respected. Beginning the conversation, the nurse should use straightforward language, avoiding medical jargon that could confuse the patient. It's important to present the information honestly but compassionately, ensuring that the patient understands the situation fully. For instance, the nurse might start with, "I have some important updates about your health and I want to discuss them with you." Active listening is crucial. The nurse should allow the patient time to process the information and express their feelings or concerns. This approach not only respects the patient's emotional response but also fosters trust and openness in communication. The nurse should encourage questions and be prepared to answer them clearly, reinforcing that the patient is an active participant in their care plan. Additionally, providing information about the next steps, including possible treatment options and support services, can help the patient feel more in control and informed. Following the principles of the Patient Self-Determination Act, which emphasizes the importance of patient autonomy, the nurse should reinforce the patient's rights to make informed decisions regarding their care. By engaging in effective therapeutic communication, the nurse can help the patient navigate difficult emotions while ensuring they understand their health status and treatment options. A patient who is in a post-operative recovery unit has expressed concern about their ability to pay for the hospital stay, but they are also experiencing severe pain. According to Maslow's hierarchy of needs, which need should be addressed first and why? Answer: in applying Maslow's hierarchy of needs, the nurse should prioritize addressing the patient's severe pain over their financial concerns. Pain management is categorized as a basic physiological need, which forms the foundation of the hierarchy. Addressing physical comfort is crucial for recovery and overall well-being. By effectively managing pain, the nurse helps the patient regain their focus on healing and recovery, which is essential for successful post-operative outcomes. Unmanaged pain can lead to complications such as increased stress, slow recovery, and longer hospital stays. The nurse should assess the patient's pain levels using appropriate scales, implementing interventions such as analgesics, positioning, or other comfort measures to provide relief. Once the patient's immediate physiological need for pain relief is addressed, the nurse can then turn to the safety and security needs, such as discussing financial concerns. This might involve connecting the patient with social services or a financial counselor to explore options for managing hospital costs. By following this prioritization based on Maslow's theory, the nurse demonstrates a holistic approach to care, ensuring that the most critical needs are met first. After implementing a new patient care protocol for managing diabetic foot ulcers, the nursing team observes inconsistent wound healing rates among patients. What steps should be taken in the evaluation phase of the nursing process to improve the protocol? Answer: in the evaluation phase of the nursing process, the nursing team should engage in a systematic review of patient outcomes associated with the new protocol for managing diabetic foot ulcers. The first step is to collect data on the wound healing rates, comparing actual outcomes to the expected goals outlined in the care plan. The team should analyze this data to identify trends or patterns, such as which patients are experiencing slower healing and whether specific factors, e.g., adherence to care, underlying health conditions, are contributing to these outcomes. A multidisciplinary approach may be beneficial, involving healthcare providers such as wound care specialists or dietitians to gain insights from various perspectives. Next, the team should gather qualitative feedback from patients regarding their experiences with the protocol, including any challenges they faced in following care instructions. Conducting surveys or focus groups can help identify potential barriers to effective care. Once the evaluation data is compiled, the nursing team should convene to discuss findings and brainstorm potential improvements to the protocol. This may include revising educational materials for patients, enhancing follow-up care, or modifying the treatment approach based on patient needs. Finally, implementing the changes should be followed by continuous monitoring and reevaluation to ensure that the modified protocol yields better patient outcomes. This ongoing quality improvement process aligns with evidence-based practice principles and fosters a culture of excellence in patient care. A nurse is preparing to administer high-alert medication. What precautions should the nurse take to ensure safe administration? Answer: administering high-alert medications, which have a higher risk of causing significant harm when used incorrectly, requires meticulous attention to detail and adherence to safety protocols. The nurse should first verify the physician's orders, ensuring that the correct medication, dosage, route, and timing are noted, as per the 5 rights of medication administration. Before preparing the medication, the nurse must perform a thorough review of the patient's medical history, allergies, and any current medications to prevent adverse reactions or interactions. Utilizing the 2 identification method is essential. The nurse should confirm the patient's identity using 2 unique identifiers, such as the patient's name and date of birth. When preparing the medication, the nurse should ensure a distraction-free environment to maintain focus and accuracy. Double-checking the medication with a second nurse or utilizing a pharmacy verification system can further enhance safety. Additionally, the nurse must be aware of the specific protocols related to the high-alert medication being administered, such as monitoring parameters or laboratory values. After administration, the nurse should closely observe the patient for any adverse effects, documenting the medication given, the time, and any patient responses. As part of a community health initiative, a nurse is tasked with teaching a group of adolescents about healthy lifestyle choices. What strategies should the nurse employ to engage this age group effectively? Answer: to effectively engage adolescents in learning about healthy lifestyle choices, the nurse should employ interactive and age-appropriate teaching strategies. Adolescents are often more responsive to hands-on, participatory activities rather than traditional lecture formats. The nurse could start with an interactive workshop that includes discussions, role-playing scenarios, and group activities that encourage participation and peer engagement. Utilizing multimedia resources such as videos, social media platforms, and apps can also resonate well with this age group. For example, presenting short videos that highlight the importance of nutrition, physical activity, and mental health can capture their attention and make the information relatable. Incorporating real-life scenarios relevant to their lives can help adolescents connect the material to their experiences. The nurse could organize challenges or competitions, such as a 30-day healthy eating challenge, to foster motivation and peer support. Finally, it's essential to ensure that the information is delivered in a relatable, non-authoritative manner, using language and examples that resonate with adolescents. By fostering an engaging and supportive learning environment, the nurse empowers adolescents to make informed decisions about their health and well-being. A patient diagnosed with influenza is admitted to the medical surgical unit. What infection control measures should the nurse implement to prevent the spread of infection? Answer: to prevent the spread of influenza in the medical surgical unit, the nurse must implement standard precautions alongside additional infection control measures specific to respiratory viruses. Initially, the nurse should ensure that appropriate personal protective equipment (PPE) is used. This includes wearing a mask, gloves, and gown when interacting with the patient to minimize the risk of transmission through respiratory droplets. The nurse should also encourage the patient to wear a mask when being transported out of the room. Hand hygiene is paramount, that the nurse must perform hand washing or use alcohol-based hand sanitizers before and after patient contact, as well as after touching potentially contaminated surfaces or items. Isolation precautions are critical. The nurse should place the patient in a single room, if available, to limit exposure to other patients and healthcare staff. Signage should be posted outside the room to inform other staff of the need for precautions. Regular cleaning and disinfection of high-touch surfaces within the patient's environment should also be emphasized, as influenza can survive on surfaces for several hours.